Everyone, today we have our another new episode, and we have our young speakers, Mr. Saleh and Mr. Kumar. So today we're going to discuss about remote medicine. This is very important in terms of developing nations. One of my friend from India, but he live in Scotland, and another friend from Bangladesh. So they may discuss some different dimensions about remote medicine. First, I want to give. Thank you, Mr. Kumar. What's your experience in Scotland, as well as how you want to share your experience and view about remote medicine?
Definitely. Thank you, Sharif. I mean, it's great to meet you again. And I mean, as you said, I mean, there is a huge difference I face from India to Scotland. See, whereas in remote medicines or remote consultancy back in India, I mean, still, I mean, people try to go to a doctor personally and try to approach them. They don't want to take advice remotely. But whereas in Scotland, right after I land, right from the COVID test, I didn't interact with human being. Everything has been sent to my location, right from my enrollment or a COVID test or consultation or anything for that matter. Everything is based on app. Everything is based on system-driven function here. So that was quite interesting for me, the transition which happened from India to Scotland. And in general, if you ask me, I've seen people back in India, they are into a lot of stress, I mean, consulting many more people in a day. There has to be a system where it has to be consolidated. There should be a periodic number of people, and then there should be some regulatory or a policy which will help doctors to perform their job better. But in Scotland, it is already done. And I think due to population, they are quite accessible at any point of time. And if I need a consultancy, I mean, based on my NI number, they can refer it, my history, medical history, my current location, everything can be accessed. And based on that, the advisors have been provided. So in that way, I mean, this remote medicine is doing wonders in these countries.
Mr. Kumar, actually, both of you, I like both of you because you are expert and you are developing your career in sustainability. So when we discuss about sustainability, we have to think about all of the sector: water, energy, even healthcare, smart cities, human rights, everything under sustainability. So, Mr. Kumar, what is your view? Because you are also a researcher, you develop a lot of startup. Do you have any startup for healthcare system or for remote healthcare or anything you want to share with us? I know you have a lab.
As you rightly said, I mean, uh, I mean, my core area is on sustainability and eco innovation. As you rightly said, we concentrate on three things. One is social, economical, and environmental. These three things for any product, even this remote medicine or a remote consultancy. I mean, when I see socially, it is very good. I mean, at the moment, I mean, it's helping many people. As he rightly said, our friend, from sitting there in Bangladesh, he can access an Indian doctor. It is quite possible nowadays because of the internet and the technology what we have. And economically also, this saves a lot of resources. I mean, money in terms of time and anything. And environmentally, we save, you know, the logistics. If you want to come here all the way from Bangladesh, you have to spend. I mean, we have to exhaust the fossil fuel. So we are saving many things. In these three parameters, if you ask me, this remote medicine and the remote consultancy is a great thing. And I've been part of. I'm not started a company for this, but I've been part of a remote accessibility. I mean, remote medicine and remote consultancy company where they asked me to do this, a basic understanding of a person from the psychology point of view. How do they think? What is the cognitive perspective of any human being when they come into uh, in a virtual room to attend a consultancy or a medicine for that matter? So we are trying to understand these three factors: the social, economical, and environmental factor. We're trying to give an awareness and also educate them because they feel want the physical attention. Somebody has to hold their hand and check what is happening, and they want to have a direct conversation, human to human. But we are slowly taking things in a different way. We are saying that the same thing can be done virtually through these three factors. So in that way, I'm quite happy and excited to work in this area, and which is really, really helping our goals, all our goals. I mean, I know Sharif, I know Salim, everybody is working towards sustainability and eco-innovation. It's really helping us to achieve that.
To Mr. Kumar, you have a very good contributions, I believe, in southern part of India, as well as now you are doing research in Scotland and some of the famous universities. What is the difference? Do you believe that we know the southern part of India, they are very advanced in research and innovation? So, is there any difference in between Europe and southern part of India, or how you are actually collaborating or how you are working together for innovation and research?
The straight difference would be the policy and the regulatory norms. So straight away, that's the difference I see. In terms of research, I feel grants are pretty much available in UK, whereas in India, I mean, the industry we have to approach, we have to write a letter, which is um, a lack in South India. But the point is, like, still we can do a lot of research, publish papers. But in UK, it's been allotted, and it's sitting in their universities. Say University of Glasgow, which I mean, last week I've been there. I saw what is the amount of fund exclusively for this sustainability, the circular economy, which we are talking. They said it's almost 171 trillion pounds, which is sitting right there. So anybody who has a good research, has a good solution for the existing problem, they can go and present it. And if the university approves it, they can get it straight away. So that's the easy access, the policy and the regulatory board, which is much accessible at the moment. In UK, I can see. Whereas in India, we have to approach the industry as well as the university to collaborate, and we have to give a proposal and start our research and submit our thesis. So in those are the difference I feel. But whereas the talent wise, as my friends were saying, I see a lot of people from Africa doing this sustainability course, the circular economy course, and eco innovations. They are doing it. I mean, and people from Nigeria, Uganda, I mean, a lot of areas. I mean, they're trying to put themselves in this shoes and creating the awareness to the rest of the world. I mean, I'm really glad to see such things happening. And of course, we are the younger generation. We can adapt to these technologies and these new methods. Whereas I see in the behavioral pattern, when the elderly person comes, we have to educate them with all this technology. At the moment, it's quite difficult because they are the one who's getting sick, and they are the one they want this remote care and the remote consultation. And the young people can adapt themselves really, really fast, and it's much easier to teach them at the moment. So these are the difference I feel. Yeah.
Thank you. Ugochukwu, what's happening in Africa? I believe both of my friends actually highly appreciate the young generation initiative in Africa. So, if you share some of your healthcare related projects or research in Africa, it will be great for our audience.
Okay. Thank you so much, Saleh and Kumar. I really appreciate the kind words which you have for the great continent of Africa. But like I said, I'm from I'm from TAFS, which is a transitional agora of future discussion where we aggregate minds to discuss about challenges facing humanity. And when it comes to telemedicine in Africa, it's actually, even though I can say that it is at its nascent age, but the young people are really taking up this project. We have many companies that have, you know, founded technology companies founded by young people that, you know, are dedicated to ensuring that telemedicine gets towards many people in Africa. But some of the challenges that we have, you know, some of the challenges that we have is actually twofold: the provider challenges and the um, the patient challenges. In terms of the provider challenges, we see that there are terms of inadequate infrastructural development. You know, because telemedicine requires a high level of infrastructure development, which has to do with high resolution of digital cameras, you know, specialized medical examinations, softwares, computers, hardware, even servers to ensure that this is, as in, the services is adequately provided to people. But some of these that I mentioned are actually not fully available or actually not equitably distributed, especially when it comes to the rural area. And furthermore, some of the hospitals in the rural area don't even have steady power supply. One of the challenges we face here in the third world countries is the issue of power. The lack of steady power supply, inhibits, our progress in the area of telemedicine. Even when these young people find, like I said, some health kiosks where they try to make sure that healthcare reach towards the people at the rural areas. And then another challenge that faces young people who try to set up telemedicine in Africa is the issue of the high cost of setup. You know, high cost of setup because to the cost of those specialized equipment, like camera screens, video conferencing, um, and other telemedicine facilities are so high that young people who try to bridge these challenges in Africa, even though um, they still encounter this and try to surmount it, find it like a bottleneck. It's a doubting challenge for them to push forward on that area. And another thing is the issue of the mindset of our people. Sometimes, like Kumar said, the old people who actually need this thing more are skeptical of the adoption of telemedicine. In essence, that was who need because to move them from the house to the hospital is actually daunting. It's about they're not too physically strong to engage in that, but they find it skeptical when you ask them that, from here, from a hospital there, they can be watching the screen and they'll be doing the procedures to ensure that they get better. So that mindset is another bottleneck that that resistance to change is to adopt something new is actually a barrier to that we young people encounter when it comes to the issue of telemedicine. And another note is that on the part of the patient, to actually procure the things that we need, that they need to be monitored. Like I have a friend in US, the dad is sick here in Nigeria. He has to install some medical equipment, in the house, so as to monitor the dad's health from US. So, but not everyone can actually have such amount of money to buy those equipment. So the lack of affordability of telemedicine services, we actually we have a young person who has founded a health kiosk or a telemedicine facility, but to be patronized, and so that both the patient and the provider can come together to achieve the aim of qualitative health care. That gap of high cost in terms of both the patient and the provider is actually there. And then, well, on the maybe I stop here, but the fact is that some of these challenges, all boils down to the issue of kind of financial incentives, which is our major problem, and then infrastructure, which is it. But the young people keep pushing because we have many telemedicine facilities. I mean, here in Nigeria, we have 247 telemedicine facilities. We have healthcare evaluation services, telemedicine facilities. We have prospect telemedicine facilities. There are so many of them, but this challenge still inhibit the potency and the achievement of qualitative results when it comes to telemedicine here in Africa.
Thank you. This is really great. There is some question from audience from Onika Shams. She want to know how do you assess telemedicine? So, Mr. Arman, what you want to add for this question?
Okay, so in terms of assessing the telemedicine, first of all, I would like to focus on the factors of the severity of the disease, because actually if a particular patient is suffering in very severe way, then maybe a remote medicine service may not suitable option. Rather, it should be focused on the physical contact with between patient and physician as well. So second thing is, and I like to put emphasis on the access of internet facilities. Like as we know that without internet facility, telemedicine is utterly impossible at this moment. So actually, people prefer video calling or calling facilities over Zoom or WhatsApp, suppose. So through these features, they can serve telemedicine service. So definitely, in terms of assessing the telemedicine service of a particular country, then secondly we need to assess the strength of the bandwidth service of the internet, and definitely the the infrastructural facility of a particular medical center is also an important factor, because they have to they have to put such sort of amenities where consultants can facilitate uh, patients from the remote areas. So that's the things I think that may be the successful criteria of a particular remote medicine service. Maybe there are other options. Maybe other speakers can insert other aspects as well. Yeah.
Okay, sure. Mr. Kumar, Mehdi want to know how do you evaluate the effectiveness of telemedicine? Excellent. Today's session is very exclusive because all of the young talented people is here, and all of them actually originate from, including me, from developing nations. So our World Talent Economy Forum is an advocate for modern science, engineering, and technology for developing world. So I believe this dialogue will be very helpful for our country. Ugochukwu, he is also from TAF, Transdisciplinary Agora for Future Discussion. And I believe that they have a very important summit next March. So Ugochukwu, what you want to add? We are discussing about remote medicine. Especially, we want to know the remote healthcare system in Africa. Ugochukwu, can you hear me?
Okay. Thank you so much for bringing me. Yes, I can hear you. Can you hear me too?
Yes, sure.
Can you hear me?
Yes.
Okay. I'm happy for your invitation today in this show, because this particular aspect of discussion is very key in bridging the hiatus in the broken healthcare system over here in Africa. Because frankly speaking, the only way through which the young ones around this can have an edge, a competitive edge in the area of medicine, is through virtual medicine, through remote medicine, or otherwise as call it telemedicine. And if you go by the statistics of the World WHO, you find out that the number of sick people in Africa, is quite enormous, and the number of related deaths, mostly occurring in the villages and in remote parts of Africa, is because of lack of access to basic healthcare facilities. And that's where telemedicine comes to bridge this gap and democratize access to healthcare to people who otherwise wouldn't have had access to them. So telemedicine, as let me speak of Nigeria, where I come from. The use of telemedicine dates back as far back as 2007, when the National Agency for Space and Research, in collaboration with the Ministry of Health, tried to inaugurate some what we call health kiosk, like a small place where people go to buy some things, health kiosk, where people can easily access medical services. Because with the increase in the number of rates of women who die during childbirth, this becomes necessary that people can actually access healthcare in a way that we help in improving the healthcare educational system. But the problem is, with the advent of COVID-19, it became more necessary, if I use that word, it became more necessary that telemedicine, you know, is kind of needed to be built because people can't go to hospital anymore for fear of contacting COVID. People can't associate anyhow. So the only way is to contact a remote doctor to give you access, to give you knowledge on how to manage your own core healthcare health challenges that you have while in your home. So there are divergent companies that goes towards that in Africa, and we hope to improve on it as we go towards it. But it is actually a key element in um, the region of the healthcare hiatus we have over here in Africa, especially in Nigeria, where I come from.
Thank you. Like one thing, Mr. Saleh, I want to do, even as we work with different developing nations. Recently, we work with Rwanda governments as well as their local collated lab. Uh, so I just want to know what is the, let's say, some point I saw even Africa has many discipline activities in terms of sustainability. What you are expert in circular economy, they are also taking many initiative. I do not want to say everyone 100% success, but in terms of knowledge gathering, in terms of innovations, in terms of contribution, they are also taking a lot of initiative. What's happening in Bangladesh? What is your view?
Mm.
Because example, I am sure that with your TAF initiative, anybody can impressed. They are developing many high quality innovation. They are developing high quality research publications, as well as they have a high quality conference for Industry 4. But what about Bangladesh? What's
Mm.
happening? How they
Oh.
integrated with the knowledgeable, like knowledge-based platform or knowledge-based activities?
Yes, so thank you. Yes, in terms of remote medicine services, I have seen the tremendous development in a couple of years, and as I said before, due to this pandemic, this development has been accelerated. More cell phone apps has been developed in where people can virtually and remotely communicate with doctors and physicians, and so on. Even if there are services where where the attendants can take samples by coming home, and you don't have to go to the test center for testing COVID. Yes, they actually only facilitate this service only for those who has some symptoms. But yes, if I would like to go to in a foreign country, then definitely I'll have to go for the test center. So yeah, so there are developments, and I have seen some sort of conferences, but yes, so there should be more research platforms should be established. And recently I have seen that many universities are keen to develop their research profiles lately. But yes, it is quite appreciated that nowadays universities are recognizing research activities, and universities are now creating funds, and governments are also pressurizing universities that yes, you have to you have to develop research centers, you have to publish papers in order to make progress in global university rankings. But yes, there are activities are there, and yes, definitely, and this sort of activity should be sustainable. It means this sort of activities should be persistent. It should not be stopped anywhere. So it should be continue. And as you say, as you always say, that we are the talent people, we are the young generations. Yes, so we actually prefer research works in terms of which we are nowadays considered as the main things in academic perspectives. Personally, I am conducting research works activities, and I'm trying to publish my papers in reputed journals, as I have already two papers in Scopus Q1 journals. So yes, there are some revolutions, there are innovations, but yes, in terms of comparing with Africa, yes, I have also seen their developments in my areas, that is circular economy and ethical consumption. And I've been invited to one of their programs. That was a circular economy show in Rwanda, and another program what a circular economy show in Africa. So I have seen their innovation. I have seen their activities. I have seen their research works. It is really highly appreciated, and I must say that we we haven't known about the contributions. But actually, after attending their shows and after participating their roundtable discussion, I have learned many things that yes, as developing nations, couple of African countries are doing much better than than many other developing countries all over the world. Definitely, it's really highly appreciated.
Thank you. Thank you.